another episode of Dynamic Joints. This is your favorite physical therapist, the one and only Dr. Tyre.
And this is Dr. Angie, the best occupational and physical therapist on this side of the green earth.
And we are the owners of Dynamic Dual PT, which is an outpatient physical and therapy clinic in West Palm Beach, Florida. So today's topic is, which I think is super important.
It is.
When do you come and see us?
I think it's super, super important because a lot of people don't come until they have, you know what?
A crook in their neck and they can't move it. So
No,
they
I,
drop.
I was going to say pain.
Oh,
I was going to say pain.
Oh.
Yeah, that's when they come.
yeah. But when they can't move.
Right. When they slept on that night or they picked up that box of wine. Because a lot of people drink box of wine these days. It's cheaper.
And so that box of wine, when they pick it up, it's just like poor body mechanics. And then what they do, pull a muscle in their back.
And then they hobbling around in pain, can't go to work. You know, the same old script.
And then that's when they come and see us. And then they expect us to fix them in a day.
Right. But they had that back pain for about 10, 17 years.
10
to 17 years. Absolutely.
Right. So I feel like from a therapist perspective, you should come and see us more so for preventative before it gets worse. So like that first little ache that you feel, you may be like, okay, I'm just going to wait it out.
Right.
Let me take some Tylenol or Advil or some kind of ibuprofen and just wait it out and see what happens. Eventually, sometimes it does go away with rest, but then you're more prone to re-injuring that same area. And then the next time you may be having more pain, and that pain longevity may be even worse.
Right. I think we get a lot with CrossFitters because they're powering through these workouts. They just want to get done. They have so many reps they have to get done in a certain amount of time. And so they end up pulling something, usually in their shoulder or maybe even their knee, and they work through it. They can't work out anymore, so they rest a day or two. They realize that, okay, I feel better, and then they get back to it. And that's when we really get those repetitive injuries that take a longer time to heal because now we have to go through the healing process all over again.
Right.
And so if somebody just comes to us first when they start to feel these things, or like you said, like that preventative side of things, let's look at your posture. Let's look at how you move through these movements because sometimes the weights are too heavy. And if you have poor posture on top of that, you're asking for a disaster.
And not only poor posture, but if your body is fatigued, it's going to start compensating elsewhere.
Right.
And it's going to pull different areas or other areas that weren't meant to be used in that capacity. And now you have overextended your body and your muscle groups. And now that's an environment for injury.
Right. You're asking for it. Absolutely. Nonstop. You're asking, you're like, come hurt me, body.
Absolutely.
Because I'm not listening to you.
Absolutely. So here at our clinic, like Dr. Angie was talking about posture, we think it's super important that you understand the gravity, I would say, of posture, because then that would help offset a whole bunch of other issues that you may experience or even may not experience because you have corrected your posture. And so what does that mean? What does posture look like?
I feel like people often think, oh, posture, let me sit up nice and tall, right? But we have, when we go out and do our corporate talks, we're telling people it's not just from the top up, it's from the bottom.
I'm going to turn my body like that so I could be comfortable.
Okay. I'm glad you're comfortable.
Yeah.
This is what we want, comfortable.
Right. Absolutely.
We want you to be able to figure out what are your feet doing, what kind of shoes are you wearing, because that plays a big factor into your knees and to your hips and to your low back, which then is the bottom up approach of posture, which we often forget about. People tend to just sit up nice and tall and engage their core, which is true. You need to do that. But you also have to be mindful of what kind of shoes am I wearing? How are my feet planted? Do I have a wide base of support? All those matter because muscles don't know how to work unless they're in the right alignment.
And what does it mean when you say wide base of support? So that means that your feet are outside of where your hips are.
Right.
And so that will, like Dr. Angie said, alter your whole body mechanics. And then again, muscles are activating that shouldn't be activated or overactivation. And now you're fatiguing it out.
Right.
And I think I'm probably just, going off the
script.
Yeah, which I normally
do. To do it all
because I like to talk. And,
yes, she does.
And I can do that.
All the time.
Because that's the way God created.
With the mouth.
Okay. Hey. But when we talk about having these muscles pull or being overextended or overactivated, I like the analogy that you say when there's a gas tank,
right,
and your body is the gas tank, and your muscles are. I mean,
would you like me to tell myself because you're about to mess it up?
I am.
And they're gonna be like, "Oh, she real smart, but she don't sound
The
right."
colloquialisms, I
that's
always
not you.
The black calling it kettle corn.
Right. Let's not show them your. Let's not show them
because this is me.
Okay, it is all of her, and I have to correct some things. She knows exactly what she means, people.
Yes,
but sometimes dancing is priority, right? Exactly. So what I always say is we have this thing called strength and we have this thing called endurance. And no matter what we're using in our body, they either have a lot of strength or endurance, whatever you want to put, but that's your gas tank. So if you use a lot of gas in doing, like, let's say like squats, you're doing squats, your muscles are going to fatigue. Your gas tank is going to go empty really quick if you don't have a lot of strength. And if you have poor posture on top of that, now your muscles are going to try to figure out, where do I get more strength from? Pulling from somewhere else. So while we're doing squats and we're focusing on our glutes or our quads, we're really not anticipating the pull from our low back. And that's what's happening when we have no fuel in that tank. That endurance level has gone down because we don't have strength. So we have to make sure that we monitor our bodies, which is why it's good for preventative care, to go find your therapist to say, hey, can you watch me do some of these things? I don't want to have injury. I feel things that I don't like the way it feels. Can you make sure I'm doing them correctly? Because you want to make sure that you protect your body so that you don't have an injury because you have strength that doesn't exist in certain muscles, or you have very little endurance, and we don't want that to happen.
That's true. And so if you reside in Florida in the near West Palm Beach area, you can always drop by and see us, and we are more than welcome to do a partial assessment on you. And so I know a lot of people are like, well, I may need a doctor's script, or I may need a referral, whatever the case may be. But the good news in Florida, there's called direct access.
Right.
So you don't have to necessarily need your doctor to be on board to help you feel better, to help you feel more informed about your body and how to help your body improve on whatever areas that you feel like needs to be improved in. So I think that's a nice little tidbit for our listeners to know.
Absolutely. And it's not just Florida. There are a lot of states that have direct access. Now, the caveat to that, you have 30 days before you need the doctor to sign off on it. So you can find you a therapist in your area that accepts your insurance or pay privately, because a lot of therapy clinics are now going to that route due to insurance. We'll talk about that another day.
Absolutely.
But for therapy-wise, it's great to see a therapist for all realms, right? We work from the head to toe. We have training in everything. Some people specialize in certain fields, but a physical and occupational therapist can literally work from the top of your head to the bottom of your feet, depending on what injury you may have. And Dr. Tyre knows she's a pelvic floor therapist, so that's another realm that a lot of people aren't aware of. So I think this would be a great time to inform the listeners and watchers.
So pelvic floor, if you will, just think of the area where your genitals reside, as well as those organs that are encapsulated around your pelvic girdle area. And so a lot of people may not understand or be aware, or even may be shy about talking about this kind of issue because it's a vulnerable issue, and some people may categorize it as it being embarrassed. But I'm here to tell you that you are not the only person going through what you're going through regarding your pelvic floor. So that will entail incontinence, right? So it can be, there's different forms of incontinence. Are you able to hold your bowel? Are you able to hold your bladder? And if not, what are some things that you can do to help offset that kind of frequency? Or if you're having issues with, more so women, if you're having issues with accepting object in your vaginal area and it's painful, then how can we help you with that from a pelvic floor therapist perspective? Athletes, like if you're a high-end athlete and you're training day in and day out.
Like me.
No.
High-end.
No. in your dreams you may be, but in reality, you're not.
Okay,
So-
whatever.
So, like
It's
if you
true.
like if you are an athlete, like an elite athlete, and you're doing a lot of jumping or a lot of pounding on your body naturally goes into like there is a form of weakness in that pelvic floor, and a little bit of leakage may come out. And so again, it's not abnormal, it's just not normal. And so we need to make sure that we get that situated sooner rather than later. And so there's things that a pelvic floor therapist such as myself can do and help you with. That's just a little caveat. If you want to know more information, come and see me personally. All right.
Right.
So let's,
Just her. That is not my realm.
and that's okay. And that's
Right.
and that's okay.
And that's where the therapies have their specialties, right?
Mhm.
I love bones and injuries. I love getting somebody back to what they were doing.
Mhm.
That's my thing. You like to be in somebody's pelvic floor, but
I do.
that's
I
neither
do.
here nor there. It's whatever you prefer.
Yes,
And that's all right with me.
it is.
Somebody has to do it.
Right. And I'll do it. And I'm okay with
Right.
it.
Because it's not me. It's not me at all.
And we thank God for that.
Yeah, we do.
thank God
We do,
for
we
that.
do.
Yeah. And
Right.
so let's talk about now it's story time, right?
Right.
Because we want to let our listeners know. And again, we talked about caution, but don't judge me because
Right,
I'm
because you
leaning.
look real comfortable.
Because I'm leaning, okay, because I'm comfortable. We're having like a conversation. This is something that we're sitting on the couch having some TED talk time. I don't know. I'm drinking a glass of wine or water, whatever is your
Right.
preference or what have you.
Yeah.
But I think it's story time because I think it's important for our listeners to understand, like, when is it actually good to come in and see a therapist? Yeah, we skated on the issue as far as making sure, like, if you're in pain, what have you. But I want us to make the connection with you in regards to what we have observed with our patients and also what we've observed with ourselves, because we're human and we get pain as well.
Right. I'll start with a little caveat. A lot of times people don't understand that physical therapists actually spend a lot more time with you than your doctor. And we ask more in-depth questions to identify what's actually going on. I like to play detective. If there was another career option for me, besides me being like a lunch lady, I would definitely be a detective. No need to pause. We're gonna push right through that. If y'all want to talk to me about my lunch lady dreams, that's fine. You DM me. But what I'm going to tell you guys is that we are able as therapists to identify smaller details that matter that the doctor may not have been able to pick up. For instance, you go to the I went to the orthopedic doctor because I was having knee pain. I knew I needed to rehab my knee. It wasn't getting better as quickly as I thought it should be. I needed to make sure that nothing was damaged, nothing was torn. Go to this orthopedic. The intake person asked me like 4 questions, like, did you hear anything pop? How long has it been going on? Blah, blah, blah. I told her I injured it when I was working out because remember, I am a real athlete.
Do you want to tell them how you injured your knee?
No.
Real athlete?
No.
Okay.
Neither here nor there.
Okay.
So I go in. I'm waiting on the doctor. The doctor comes in. He's like, looks at my x-ray. He's like, okay, I know we need to give you an injection because I know exactly where your pain is. So on the inside of your knee. So that's where I'll put the injection at. And I was like, he didn't even talk to me. He didn't say, ask me 1 or 2 questions. He didn't say anything. The first comment out of his mouth was, let me give you an injection. But I already know how injections work. They're a Band-Aid for whatever your issue is. It's not identifying the problem, it's easing the pain. And I didn't want to ease the pain, I need to identify the problem. So I told him, I'm a physical therapist and I've been doing my rehab. It's just not getting better like it should be. So I really would like an MRI to make sure nothing is torn. Then he got in tuned in it. Then he asked pertinent questions. Then he cared about what I thought. But it's sad that was his first line of defense was that he needed to give me an injection. So what I'm saying is don't ignore your pain and look at the entire scenario. If somebody is pushing something without asking you questions that are pertinent, then you probably want to shy away from that person, right? So long story short, he was upset that I didn't want to take his injection, which I didn't need it because he was talking about my meniscus, but come to find out it was my quad tendon that was actually inflamed and needed rest. So all the workout that I was doing was only making my issues worse. So then I had to revamp my plan of care for myself. But if you don't look into what your doctor is prescribing or why they would push something on you, then it's really, really important that you find somebody else.
And so that's very good. And I hope that you guys, understand you have to be your own advocate,
Absolutely.
regardless of where you go. And to talk to any doctor, you have to be your own advocate. My story was, I had a patient. She had a history of back pain. So she had moments of back pain. But this one particular day, she was making up the bed. And what do you mean by making up the bed? She was putting on a fitted sheet on the mattress. And what happened was one wrong move and it caused her back to just be out.
Mm-hmm.
And with that, she could not stand up. She could not walk. She needed her son to physically help her walk because she couldn't put any weight through her legs.
Right.
And the first thing that she did was she came to us and we helped her rehab her back. But the one question was, when did this happen? Well, it happened this morning as I was making up my bed. Okay. But when did you start to experience some level of irritation of your back? Oh, a month ago when I twisted and turned wrong to pick up a case of water, I believe it was. So right then and there, when she twisted and turned to pick up that case of water and she felt that first inkling of discomfort in her back, that's when she should have called us, because that would have prevented that whole injury or that whole episode of her being in so much pain that she couldn't stand and she couldn't walk and she couldn't move. And it took a little bit longer for her to recover, one, because she was an older woman, and two, she's had history of back pain, and three, she ignored the primary symptoms, and four, it got worse.
Right.
So we say all of this to give you some advice that one small pain can grow into it being huge. It could be a nuisance.
Right.
It can cause you to be on pain medications that you originally didn't want to be on.
Right.
It can cause your body to go into all these different kinds of, abnormal episodes because your body wasn't meant to take all these different kind of pain medications, all on the set of you not being proactive,
right,
and making sure that you get the care that you need.
Right. And I always say, don't ignore your symptoms.
You can't.
And that's a life story for me. If I didn't have my best friend, I probably wouldn't be here today. But that's neither here nor there.
No, you're not going to make that comment and then skate through it, okay? Because first of all, listeners, friends, okay, first of all, they're not listeners, y'all are friends. Let me be real candid with you guys. She is a therapist, and yes, she is a good one, right?
Thank you.
But she does not listen to the world-renowned therapist that is sitting to the left of her, right? So she would be like, "Oh, I'm hurting," whatever the case may be, and I ask pertinent questions. Where does it hurt? How long have you been having this discomfort? All of those things.
Yeah.
And she, being like some of our friends, waited until she couldn't function. And then that's when she came, or that's when she needed me. Now, with that being said, did she listen, friends? No, she did not listen. Why? Because she is hard-headed. Go ahead.
I'm not going to accept that.
Oh, well, then tell them. Tell them. Then.
First off, I'm not hard-headed. I listen to the people I want to listen to.
There you go.
She is not the one that I want to listen to. And at that time, I knew. So we're talking about my appendix, right?
Oh, yes.
So
tell our friends.
I thought it was like a bad stomach ache. I thought, I Googled, right? We're all WebMDers. And so I'm like, hey, it must be a kidney stone. She comes to me, no, it's your appendix. I'm like, no, because the only fix for that is surgery. I'm not having surgery. So it's a long weekend. It was like Memorial Day, I think.
It was
Memorial Day. Yeah. So I'm in bed. I'm like, you know what? I'm just going to lay still. As long as I lay still, nothing hurts. Well, that Tuesday came and she's like, all right, we're going to work. And I was like, I don't know. Can barely walk here. She says, well, if you can't walk, then you're going to the urgent care. And I was like, I'm not going. I'm fine. I'm going to tough it out.
Because she listens to those who she wants to listen to.
It's true. And it was myself. I did not want to have surgery. So long story short, I go, they say, you know what? We got to prep you. You're having surgery, your appendix rupture. So don't ignore your pain, because I could have easily died.
Yeah.
I did have a blood infection because my appendix did rupture, and I was in my bed almost 4 days with this happening. Instead of me going to the emergency room that day, they probably could have, it would have been a smaller incision, right? Because my incision is probably 3 times what it was because it was so inflamed. And when they had to remove it, it did rupture. So I wouldn't have been in the hospital as long. Don't ignore your pain. It's a warning sign for something. So we have to figure out what it is. And if you don't know, your best bet is your therapist, or for my case, it was the ER.
Yeah. So moving forward, let's talk about some of the services we provide here at our lovely location.
So we provide pain, torture, and dislike, right? We are, is that what they said?
No.
Oh, I'm sorry. We provide magical hand. Like my hands are like miracle workers.
Or baby. They call her baby hands.
They do, but they don't feel like baby hands. And I'll record something and show y'all too. So we manual therapy.
Yeah.
We're very skilled oriented. So whatever your goal is, we want to get back to that. But one of my favorite, I know Dr. Tyre loves it.
Oh, I do.
Is
dry needling. And what is dry needling? Best friend slash business partner. I was going to ask you.
But you always ask me questions.
Yeah, because I like it. I'm a reporter.
You're not a reporter. You answer the question and then I said, That's how it goes.
So dry needling is a form of modality that can help decrease your pain and improve muscle performance immediately. Now, is it comfortable? Some would say no. Some would say actually it is painful. But the reason being is because we have developed trigger points throughout our body. And trigger points is formed when we overuse a muscle, or if there's an injury to that muscle group, or if that muscle is being
used improperly.
Right. And so your body forms these trigger points. Again, our body tries to protect itself from inside out. And sometimes what happens is that protection can actually cause us to be in pain or have a painful dysfunction. And so we just treat that trigger point with a needle the size of an acupuncture needle, probably a little bit bigger in size, particularly if we're going to deeper muscles, just to release that trigger point and ultimately releasing that patient's pain.
Right. So a lot of times when we do dry needling, what you'll feel is that it's not just localized in that spot. It actually may radiate. And I know Dr. Tyre talked about how pain can be in one spot or it can spread. Usually by the time that we have to address the myofascial trigger points is when that you're having referred pain. So something that is painful up here is going to send signals down. And there's been research that show that people that have been getting carpal tunnel surgeries and no relief actually have a trigger point behind their shoulder blade, which has been causing the symptoms all along. So sometimes where your pain is not actually where your pain is, if that makes sense.
Right. And so it's so important, again, to just seek out your physical therapist or occupational therapist to be your first line of defense in regards to just helping your body feel better, move better, and perform better.
Right.
So I think I talked a little bit about our fun fact, not knowing that it was a fun fact, but knowing that Florida is a direct access state. And what that means, again, I'm going to reiterate that, is that you can actually come and see us today if you want to, without the consent of your doctor, which I think is really good, because then that makes you in charge of your care versus your doctor.
Right. And our other piece of that fun fact is a lot of people don't understand what their car insurance actually pays for if you were in a car accident. PIP, personal injury protection, that is part of usually your insurance policy, that if you were to get in a car accident or someone else was getting in a car accident, your car insurance will actually pay for your therapy. So there's
Yeah.
actually no excuse, whether you have health insurance or not. It's no excuse not to get help. You're better off, even if you don't really feel anything, go use some of that to actually see what kind of injuries might I have in the future because of how I was in this car accident.
Absolutely. So again, thank you for tuning in to another episode of Dynamic Joints. Please like and subscribe, and we'll see you on our next episode. Take us out.
Da-da-da-da-da-da. We are leaving today, but we thank you for watching. I don't know how to rhyme, but we'll see you soon.
Bye, guys.
Bye.
That was a good one.
Was it? Yeah. I was trying to rap with soon, but I didn't
It's
have
okay.
it.
Spoon.
Moon. That's about it. Yeah. That's it.
Room.
That's it.
Okay. Bye, guys.